these GI cases that we're going to see, we've done our assessment of them, but what we're going to feed them, well, it really depends on what the vet has diagnosed. It might be the case that they haven't actually made a diagnosis, because a lot of these GI cases, making a diagnosis is almost impossible. It is so difficult. A lot of these cases, we're literally treating or managing the clinical signs that we're seeing, and we never actually get to the bottom of what causes this diarrhea to happen all the time. I see a huge amount of dogs that, I'm going to say, behavior, anxiety, stress also play a little part in the amount of diarrhea that we're seeing. And I'm sure you see it yourself. You'll get a dog come in, to be castrated or something, like a routine sort of procedure or something. And it has the most horrific colitis when it's with you. It's not infectious. There's nothing actually poorly wrong with that animal. It's all down to stress. So some of these things, we can't manage with nutrition. We need to look at the sort of behavioural aspect as well. So when we're doing the nutritional plan, we need to determine what to feed these animals. And there is no hard and fast answer to this, I'm afraid. It's a really difficult one. And that's because GI issues is probably the most difficult thing to actually manage with nutrition. What works well for one might not work well with another, and it really is trial and error until we find the right thing for that pet. And that's why there's so many different GI diets out there. I'm not going to say for a dog with colitis you feed this, with a dog with this small intestinal you feed this, because that might not be the answer for all of them. We have a good idea that with colitis we feed higher fibre. It's not going to work well with every colitis dog that you see. It depends why we're having colitis. Is it because we have a sensitivity to food? Is it a stress thing? It could be an infectious thing. There's so many reasons why. So how much we're going to feed? Well, you're going to do your nutritional assessment. You're going to work out, body condition score, all that sort of stuff. You're going to do the maths, I'm afraid. You're going to do the RERs, work it all out. How are we going to get the food in? Sounds a bit silly, sounds a bit of a simple question. So are these animals inappetent? Getting food into an inappetent animal, I'm going to say, is the most difficult thing to do in veterinary nursing. Getting an animal to eat is, really tough. So inappetence is a problem there, but also what happens if it's got something like an omegaesophagus, a regurg problem, these sort of things. Is positioning of these animals going to be useful? Does the food need to be made into balls so, we can hopefully get the food down? There's a lot, and I mean a lot of debate looking at kibble size, swallowing mechanisms in some dogs. We know in certain breeds, so your Boas breeds, your brachycephalic breeds, your pugs, there's been a lot of research done looking at kibble shape. And we know that almond-shaped kibbles work better than, cross-shaped kibbles and so on. We always, for dogs with megaesophagus, we were always taught to fashion the food into balls, just to help it go down. I do know some surgeons that do brachycephalic airway surgery that insist on the food going down, being fed in balls as well. There's no evidence to support either way. Surgeons, I think, have the thinking behind this, but it hasn't been proven. So it really depends on the surgeon that you're using for this. So how are we getting the food in? Will it reach its nutritional requirements? So it might be picking at its food. Okay, do we need to put a feeding tube in? It might be eating, but it might not be eating enough. Also, the frequency of feeding for GI cases is a big thing. Are we going to feed little and often, once a day, twice a day, so on.